He doesn't have any idea what it is to live with this pain, constant pain, day in and day out. No one knows what it's like.
Okay, time out.
Yeah.
Okay. Time out.
Time out.
Go ahead.
Time out.
So, should I move on to the sexual history part now, or do you think
You're absolutely fine.
Do you think?
If you happen to walk in, it looks really weird. One person is talking to the patient, and then everyone else is watching, but it's really a learning tool.
It's supposed to simulate a physician-patient interaction. And so we get actors who come in and play a role as a patient with a specific condition, and the physician's supposed to sit across them and go through a whole medical interview with them and sort of try to find out why they're here and explore the situation.
So, Mr. Cassidy, it seems like you're in quite a bit of pain even as you sit here. I know you said you've been in pain for a couple of years.
That's right.
So, I know it's in your file and all, and you've been through it with your doctors before, but why don't we talk a little bit more about the pain that you've been having?
These are difficult situations. These are things that make clinicians, particularly early in their training, extremely uncomfortable. People aren't used to talking about the details of the sexual life of strangers with them. They don't know how to ask. They don't know how to give meaningful responses. Sometimes their reactions can set patients off in a way that really distances them.
So I just went for it and just asked whatever questions I thought were necessary, and I kind of like distanced myself from like the personal to the professional level. And then like later, like I thought, I was like, did I really ask that to a person?
Have you been? Guess when was the last time you did it?
A week ago.
Okay. And do you experience? Is it also similar to sex where you sometimes have trouble getting up, or is it easier or harder with masturbation?
I don't seem to have any problems that way.
Okay.
The last thing that a patient wants is for their doctor to be uncomfortable. And so I think part of it is the almost hazing effect of becoming more and more comfortable in uncomfortable situations and learning how to manage your own emotions.
HTE students will, on the engineering side, have an avenue to how doctors think and what's going on in doctors' minds as they interview patients.
You couldn't tell who was who, and if you sat back and watched this from across the room and said, are you in medical school or are you getting a degree in engineering, you can't tell. And I think that to me really represents the idea that you can teach this. You can teach this way of thinking to people. And you can and it says not only can you teach it, but those graduate students are going to come away with a whole different understanding of the way in the challenges that the doctors face, what the doctors care about, and the nature of medical knowledge. So I want the engineers to be able to say to the doctors, I get it. I see where you're coming from. I don't fully understand how you do it, but I get that this is not easy, and I get that this is an important part of what you do.